Dear students, welcome back. In the previous session, we have discussed about the superficial fascia of the posterior compartment of the leg. And in this session, we are going to discuss about the modification of the deep fascia, that is flexor retinaculum. So this flexor retinaculum, here you can find this flexor retinaculum here. And it is, if you see the attachments of this flexor retinaculum, okay, so anteriorly, so this becomes the anterior and this is the posterior part of this flexor retinaculum, okay, yes. So anteriorly it is attached to the posterior border of the tip of the medial malleolus, posterior border of the tip of the medial malleolus, posteriorly and laterally to the medial tubercle of the calcaneum. Here you can find the tubercle. So to the tubercle of the calcaneum, posteriorly and laterally it is attached. Okay. Septae pass from the retinaculum to the underlying bone. So for example, this is the retinaculum. So some of the fibers which passes below this retinaculum to the underlying bone. Okay, so for example, this is here the bone which is present here. So and it forms a tunnel actually called as Starcell Tunnel, and this tunnel is divided into 4 compartments. Tunnel is divided into 4 compartments. From medial to lateral side, the structures which are passing through this compartments are in the first one. So here the tendon of tibialis and posterior, tibialis posterior, okay, this one is tibialis posterior tendon, and next one is the flexor digitorum longus, flexor digitorum longus, and in the third compartment, so here you can find the posterior tibial artery, okay, posterior tibial artery. So we can call it as posterior tibial vessels and tibial nerve, posterior tibial vessels and nerves in the third one. So here you can find the structures, that is posterior tibial artery and the nerve here. Okay, and the last tunnel, in the last tunnel, so in this tunnel, the tendon of flexor hallucis longus will pass through this 4th compartment of this flexor retinaculum. Okay. So each tendon occupies a separate compartment and which is lined by the synovial sheath. Okay. The nerve and artery share the common compartment. Okay, so the structures, these are the structures which lie in a tarsal tunnel. If the nerve gets pressed, it leads to tarsal tunnel syndrome. And also another important thing we have to consider here are the lower part of the deep surface of the flexor retinaculum gives origin to the greater part of the abductor hallucis muscle. Okay, near the calcaneum, the retinaculum is pierced by medial calcaneal vessels and nerves. This is all about the flexor retinaculum. Thank you.